Hi, my name is Dr. Love. I'm a doctor of Oriental medicine, practiced for 33 years. Today we're going to talk about meridian therapy. The meridians refer to acupuncture meridians. Now there are 12 regular meridians, and those meridians are approximately 1 to 2 inches deep in the body. Then there's what we call tendinomuscular meridians, which run along the surface of the body. And then there's what we call 8 extraordinary meridians. And the 8 extraordinary meridians also run top and bottom, but there's one that goes lateral, and we call that the belt channel or dymo. Now, what is meridian therapy? Well, we can use heat, pressure, sound, electricity, suction, scraping, magnets, red light, and laser. That's 9 different ways in addition to acupuncture that can stimulate the acupuncture meridians. Now, what is actually flowing through the meridian? Well, that is called electromagnetic energy. So when you have a heart attack, they get paddles and they shock you in order to bring you back. So obviously your heart works on electricity. Now, if you create friction in your hands, or you take a balloon and rub it against your shirt and stick it on a wall or a curtain, it won't fall because we call that static electricity. Well, that same electricity is what runs through your body. So heat is the way we measure energy. So if there's cold, it's an absence of energy. If there's heat, we know there's energy. Pressure. When you shake somebody's hand, you know the difference between somebody's limp shake and somebody's firm shake. So I can feel your energy just by shaking your hand. So by pressing the points along the meridian, I can increase or decrease that flow of energy. Now, meridian therapy is practiced in a very simple way. It's either excess or it's deficient. Now, what constitutes excess? Tightness, firmness, heat, pain. What constitutes deficiency would be weakness and flaccidity. Okay, flaccid meaning it's not firm. Okay, so my objective is to move that energy. Now, typically people experience pain before they experience weakness. So a traffic jam would be experienced as pain. So that means there's a lack of flow. That means there's an obstruction of flow of energy through that meridian. So we're going to use suction, which is called cupping, or scraping, which is called gua sha, to move that energy. Now, we can use heat. There's any number of ways we can use heat, but the most common way is called moxibustion. And we use mugwort, which is a very common herb, grows by the side of the road, and we scrape the underside of the mugwort leaf to make a moxa cigar. And there's many, many different ways we can do that, and in a later video we'll do one just on moxibustion. Now, electricity. Now, we all know about what voltage and amperage is, but what we use is millivolts. So we use 100 times weaker than normal to stimulate that energy. And we use it in the ear. Now, some of you may be familiar with a TENS or a trans-electrical nerve stimulator, which is a little pad which shoots electricity into the body for pain, but we use, again, 100 times weaker than normal on specific points along the body, but mostly in the ear. And we're going to do another one just about the ear therapy. So then we use magnets. Now, magnet has 2 sides. One is a repulsive side, and the other is an attracting side. So if there's pain, we're going to use the repulsive side. If there's infection, you're going to use the magnetic side. Now, why would we do that? Well, if there's pain, again, there's a traffic jam, so we're going to use the repulsive side to break up the infection. But at the same token, if we did that on the infection, then we would literally spread the infection. If we use the magnetic side, then we're going to pull nutrients in to heal the infection. Then we have red light. Now, typically, a flashlight. If you turn out the lights, and you put a flashlight on your hand, you can see light coming through your flesh. No matter how dark-skinned you are, you're still going to see that light going through your flesh. So we know that light can create heat, which can stimulate energy. Now, laser is typically a ruby rod, which can be 400, 500, or 1,000 times higher strength than a red light. But the red light is really all that's necessary. The ruby rod laser is excessive and is only used when there's extreme pain or recovering from surgery. Typically, the red light is all that's used. And then that leaves us with sound. Now, we all know what it's like to stand in front of a giant speaker and have the sound penetrate our bodies. And some of us think that's really, really good, and other people run away from it because it's too strong. Well, all that depends on your constitution. Now, if you're a weak constitutional type, then the sound would be an easy way to stimulate your meridians. We use it for children, we use it for the elderly, and the way we can do it is with tuning forks. But we all can also, you can use frame drums, we can use taiko drums, which are Japanese, we can use Korean drums, we can use a gong. There's so many different ways to penetrate sound into the body in a very positive and healing way. So that, my friends, is Meridian Therapy. Thank you.